IFA, Health Information for All, is a global health community working in collaboration with the World Health Organization. It has more than 19,000 members representing all stakeholders in global health. As I have mentioned previously, health professionals, librarians, publishers, researchers, policymakers, human rights activists, and others. The members interact on 6 global discussion forums in 4 languages: English, French, Portuguese, and Spanish, and we hope it will be extended to the 6 UN languages. Everyone is welcome to join through the IFA website, www.ifa.org. IFA was launched in 2006 in Mombasa, Kenya, to address a complex global health challenge. Tens of thousands of children and adults are dying every day due to the failure to provide simple, life-saving interventions. These interventions are often locally available, but are simply not provided due to the indecision, delays, misdiagnosis, and incorrect treatment. Thousands of lives could be saved every day if those responsible for their care had access to basic healthcare information. The rationale for IFA is described in paper in The Lancet, Can We Achieve Health Information for All by 2015, and in this paper is based on previous report commissioned by WHO. IFA has an ambitious goal. We want to create a world where every person, every health worker, and every policymaker has access to the healthcare information they need to protect their health and the health of others. There is no one-size-fits-all approach to this challenge, so the approach of IFA is to bring together all providers and users of healthcare information in multilingual community of purpose to share experience and expertise on how to improve the availability and use of healthcare information. IFA advocates for universal access to healthcare information as a prerequisite for achieving quality care at all levels of the health systems, universal health coverage, and health SDGs. IFA currently has several working groups, including community health workers, access to health research, evidence-informed policy and practices, Astana Declaration, and I would like to say a few words in particular about the IFA Multilingual Working Group. The IFA Multilingual Working Group has 3 objectives: promote sharing of experience on how to improve the availability and use of healthcare information in language other than English, provide a space for global health information in language other than English, strengthen connection among global health professionals working in different languages. IFA now has 4 languages, and we aim to have more languages, as I have mentioned to you in the future. A few weeks ago, the IFA Multilingualism Group published a letter in the Lancet Global Health with the title Improving the Availability of Health Research in Language Other than English. This letter was based on the needs and priority of IFA members who don't speak English. And in this letter, we point out that most health research is published in English only. 90% of world population don't speak English. In particular, IFA members are frustrated because language from non-English speaking countries is very often published in English only. And yet, the primary audience for such research cannot read English. For example, a study in Mozambique may be published only in English, which is of non-use to Portuguese-speaking researchers and policymakers. We call on the medical journals publishing industry to take action to address the anomaly. The simplest first step would be for the journals to make at least the abstract available in the main language or languages of the country in which the research was done. I would like to thank you very much for your attention.